Dr. Bopoto, there are challenges about some drugs that we have heard a word that there's a shortage of drugs. Can you just highlight to us what the situation and which drugs are these?
Well, information reaching us from the pharmaceutical importers is that we have an impending shortage of drugs due to delayed remittances of international payments. You're all aware that Zimbabwe does not manufacture a lot of drugs. Particularly, we've been made aware that we are about to run out of insulin, which is a critical drug for diabetics. We are about to run out of some theater drugs, some anesthetics, as well as some psychiatric drugs. And this information is coming to us from the pharmaceutical wholesalers who are responsible for importing these drugs.
And have you ever tried to engage the responsible authorities, such as the RBZ?
The first thing that we do when we come across such information is to notify our members, because our members are the ones that look after these patients on a day-to-day basis. They're the ones who will be facing these patients. We'll be running around, the country from farmers to farmers to farmers looking for this drug. So we need to make our members aware that there's an impending drug shortage, which is what we have done. Notified our members. Okay. And unfortunately, in the process of notifying our members, then some information gets, goes all over. We are in the process of engaging the Reserve Bank. Okay. We are also in the process of engaging those banks that have been identified by the pharmaceutical wholesalers to see if we can ask them to expedite the payments for these crucial critical drugs.
But what about the government or under the Ministry of Health? Have we engaged them, and what has been the response?
Well, in this particular instance, this particular issue we're talking about is not a Ministry of Health issue. Okay? It's not even a Ministry of Finance issue. It's a Reserve Bank issue. These pharmaceutical wholesalers, they've got monies in their accounts. They've made outgoing RTGSs to their suppliers outside the country.
Okay.
It is those remittances that are not going out. As a result, it's taking long for the orders to be processed.
Yes. And what do you think should be the way forward?
Well, the way forward is that the Reserve Bank needs to prioritize payments for drugs and all other health-related payments. We are told that sometimes payments are taking up to 3 months to be processed. And some of these drugs are very critical, are ordered as the need arises. And we are informed right now that some of the major hospitals, they've got 2 weeks left, worth of these drugs. And it's going to take 3 months for those payments to be made. You imagine what's going to happen. So we appeal, we're making an urgent call to the Reserve Bank that all payments for drugs must be expedited, must be high priority.